we'll have at lunch. So I haven't asked them to come up with answers. That would be unfair. They're just going to take each of them a few minutes to talk about where they sit. You know, where you sit has a whole lot to do with where you stand, if you understand what I mean. What you experience every day has a whole lot to do with what you think you need. So they're going to talk about it, and hopefully it'll ring true to some of you and be able to start some discussions. So I'm going to start with Miss Connie here. Connie, just tell them who you are, what your experience is, and what you, looking back on the last 3 years, where do you think
Since COVID.
Yeah.
My name is Connie Norton, and we've been Trip in Home Health, and I have been in home health for over 30 years. So up until COVID, totally different. After COVID, I think the most heartbreaking thing that we see in home health is, of course, the loneliness, as other people have talked about. A lot of our patients in home health, they don't have family that live here. They're just there trying to do the best they can. Maybe their spouse has already passed away. They're trying to keep everything going, their home, their health, paying bills, getting their medicines. And I think with COVID, that just tripled the loneliness, the insecurity, the fear. I think, and Becky's one of our great home health nurses, I think she would also tell you, we go into so many homes and they don't even know how to go get their groceries. They're having to try to find somebody to pick up their medicines. We've had to take patients a biscuit because they weren't able to even use the microwave. And, you know, they don't tell their children. A lot of them just don't tell their children or their nieces or their nephews. So with COVID, once it all got, or that was even worse because family couldn't come in, neighbors couldn't come in, church couldn't come in. So it just has tripled those issues with our home health patients. COVID really has caused a lot of depression, a lot of loneliness, a lot of comorbidities because they weren't able to go to the doctors or they were afraid to go to the doctors. So it really changed the aspects of being in a patient's home that used to, they could kind of do a little for themselves, or they had a neighbor that would help them, or they had a church member that would help them, or a niece or a nephew, and now COVID just kind of blocked all that. And it's really not come back yet. People are still, they've just kind of gotten used to it now. They don't help like they did. So, big problem.
Okay. Celia, I know you have a long experience in terms of I'm going to use her new name, Celia Fields, because the other one can crunch your tongue.
Okay. So hi, I'm Celia. I'm with Our Place Adult Day Center, and before I was with Our Place, we just opened last March of 2022. It's been very exciting. But before that, I was at the Cades Adult Day Center in Farragut, and that's where I was pre-COVID for several years, and then during COVID. We were actually forced to close during COVID, so all of our folks who attended our day center had to stay home with their caregivers, and we did fortunately come up with a contingency plan, and we did outreach. So we went to see all of our families that were enrolled in our program at least twice a week and offered support and activities and socialization. But we know that was a unique experience for those people that we knew, and most people did not get to experience that. The way I've seen working in day centers, the way that we help caregivers, helping the participants is the easy part, right? We get them in the program and we have access to them all day long. We get to do things for them, have fun with them, interact with them, and the hard part really is reaching the caregivers. A lot of times they come to us and they ask for help by the time they're desperate, not before, and not when they could be planning and preparing. So I see that as one of the biggest places where we can advocate as people who know who the caregivers are, is encouraging caregivers to reach out for support before they need it. One of the biggest impacts I've seen COVID is working with these caregivers, and I talk about the caregivers so much because I don't think we can talk about them enough. right? And their quality of life directly impacts the person living with dementia. I always felt this sense that when people were coming to us to access day services or just ask questions, we were kind of helping pull them out of a ditch. They needed that helping hand to get up, right? And since COVID, I almost feel like we're trying to pull people out of a deep, deep valley. They were so isolated. I think mental health issues compounded so much. I remember the first year that we were shut down, Alzheimer's Tennessee kept their research and management symposium going through Zoom. And I cannot remember the name of the doctor that spoke, but they were talking about how the pandemic was creating all this isolation, loneliness, all of these issues, and we were currently in the COVID pandemic, but they predicted that we would have at least a 10-year mental health pandemic after. And that's what I see happening. The difference in the caregivers coming to me now, as opposed to before the pandemic, I just see so much more desperation. I see much deeper mental health and physical health issues with the caregivers. And if you know about caregiving, you know that oftentimes even before the pandemic, that their mental health and physical health is likely to decline before the person they're caring for. And so that's why I just feel like it's so important to hear everything Christy was saying about caregivers, to really focus on that group of people. I have the privilege working at our place to go out and talk to a lot of people, and not just mental health professionals or caregiving professionals or medical professionals, but groups, huge women's groups of 100 who like to get together and learn, Kiwanis groups, Rotary clubs, and that's probably my favorite thing to do because I'm more likely speaking to people who have no idea about what's going on with people with Alzheimer's and dementia in the older population. And something I always try to say every time I talk to a group that's not already intimately involved is, I bet you know a caregiver, and if you do, go to them. And don't just say, what can I do to help? Because what is that caregiver going to say? I'm fine, I'm fine, I don't need anything. So don't ask, just do it. Just go to their house, bring them lunch, show up. Caregivers have such a hard time asking for help, and I think when Reverend Black was asking us to write down the questions about where you think they experience loneliness, I think one of the places they experience it is in the decisions that they're making. They feel very alone in making decisions for this person, and also probably judged, because it makes me think of before I was a parent. I was an amazing parent, right? I knew exactly how kids should be parented. Then I had kids and I was like, oh, I'm an awful parent, I don't know what I'm doing. And I think caregivers probably go through that experience, and they're probably surrounded by very well-meaning friends and family, but they feel that feeling of that they could do it better, or they think the decisions that they're making are wrong or not the best decision. And so I think one of our responsibilities is advocating for caregivers, and every time we have the chance to go and talk to people who aren't already caregivers is talking about who do you know that you can just go help, and what can you do to support them. So I don't know, Barbara, if I spoke to what you are wanting, but that would be my biggest need that I see in our caregivers, and also remembering that we may have been kind of helping them out of a ditch before, and that ditch has just gotten so much deeper since the pandemic. And so we kind of have to be more on our game, more creative in the resources that we're accessing and providing. So just reaching out a little farther.
Thank you. Thanks for the opportunity. You have to go, but
Yeah.
now tell me your name. Wendy. Wendy is what is known as an on-the-spot person. Just give us a few ideas. I know that it's been really hard with nursing homes, so.
Well, our nursing home is both skilled nursing, which is therapy, and people get to go home. Well, we also have long-term care where people are gonna live there probably until the end of their life. So for my job, I'm the social service director, and I have to work with both areas, and so a lot through COVID a lot of things that good have come out of it. We've got more telehealth, we've got more deliveries for pharmacies, we've got more grocery abilities, and those are things that they can access. That's been very helpful. But then for our long-term patients, we have you know, they've already missed 2 years because they've not been able to see their families. We had to shut down and families were only able to see them through the windows, and that was very difficult. You know, we had family members that had passed away, and just 2 years is a long span of time that they have missed a lot. So we're trying to catch up. We're trying to encourage people to get up again, get families back in the buildings again, get them busy with activities again, and trying to get back to a new normalcy. And it's slow. And like you said, we're seeing a lot more depression, we're seeing a lot more anxieties. A lot of those have come out of this as well for us. However, we've got different things in place. We're doing more patient-centered care planning, we're more patient-centered activities, and families are starting to come back again. So I think now maybe even gotten more families involved than previously when they didn't realize how much they were gonna miss. So a lot of good has come, even some of the bad.
Great, thank you. Now, Jasmine, you get to pull together. Jasmine and the people from Blunt Senior Cares, they're not new to the community because, you guys are at Blunt, Madisonville. But she's gonna pull us together and then we'll get to have lunch, right?
Yes. Hey guys, it's very nice to see all of you all. I see a lot of faces that I've seen before, some family, and it's really great. My name is Jasmine. I'm with Senior Care Partners of East Tennessee, formerly Blunt Senior Care Partners. We're a geriatric office, and we've been serving patients in Blount County for over 10 years. COVID really has been really tough with our population. You know, being a geriatric office, we focus on the care of a 55 and older patient. So in our office, we are in multiple settings throughout the area. And so we really had to change everything that we did during COVID, because Blunt Senior Care, we have 4 board-certified geriatricians and a team of over 22 nurse practitioners. So these providers, they see patients in the clinic, they see patients in skilled care, long-term care, and assisted living. So we provide services throughout the community. So every one of these settings had very integral changes that had to go on within it. Some of the things that we did within our office, of course, is that we would triage, of course, in the parking lot and try to keep the patients that had active, respiratory symptoms away. So we essentially had a well and a sick area. And then we really relied very heavily on some telemeds. And so that aspect actually has, really helped us in our practice, and that's something that we continue with. There are problems with technology that we encountered with this population and telemed capabilities. So that was just a little hurdle that we had to work through. And living in post-COVID times, some of the things that we've noticed is that our patients come to us much sicker. Patients, even now, a lot of your homebound patients or patients that don't get out very often, they don't kind of see that the rest of the world is starting to move on a little bit. So they're still fearful to leave their homes. There are lots of elderly that are still staying at home because they're afraid to get out into the community. And so, also, if you've noticed, there are now waiting lists to get certain services because people are starting to come back and starting to get services again, and they're starting to realize, oh, I need to get my mom checked for possibly dementia, or I need to have these different services, these different things taken care of that we've kind of neglected the last few years. Now there are waiting lists for lots of those things. So in our practice, we are actually implementing memory care evaluation program. So at Blunt Senior Care Partners, we'll be doing memory care evaluations because we know that in our area, for a full memory care evaluation with a geriatrician, there are waiting lists in other areas. So we're bringing that into this area. We have our new clinic in Von Orr, and so we'll be serving some of these resources and these needs that are in our community, like falls clinics and things like that, that in the past, people really weren't taking too much time in, and now they're starting to realize, hey, these services are much needed in this community. So we're really excited to be here. I have Dr. Greedo with me here today. Dr. Greedo is a fellowship trained board certified geriatrician. He's one of our 4. If you have any questions, he is also a COVID expert. And he helped Dr. Teresa Catron and Mary carry our clinic through COVID. So we're really proud of what we were able to do for the seniors, and we hope to continue to serve our communities. Thank you for allowing us to be here.
Oh, no, I'm glad you're here. Thank you.
Now, what we're gonna do is, I think that was a good review. Are there questions, concerns, or even just statements from y'all? And what I'd like to do, so that everybody can do it, is maybe just have you stand up. If we hear you, fine. If not, come up and talk here. Do those of you who wanna add, from where you're sitting, in your place as a caregiver, or family member, or provider of care, things that you think that are so important that we should look at. And basically, remember, the Memory Lane project is ongoing for the next year. We have funding from Pat Summit. And what I'm gonna tell you about, we'll start now, we'll tell a bit more. We have additional funding from the state in a project called Safe Path that works with the health department. Teresa's here. Heather was here, the health council. We actually have money to go into Monroe Citizens for the Arts. We're planning a art program for the dementia. And this project is gonna go on for the next 3 years. So in terms of having resources, and I'm sorry, obviously the source of this Safe Path program is going to be the senior center, and we're going to have Julie is gonna go back to school. But we're looking for a person to come in and work with us on that program. And the other thing I'm gonna tell you is that we are looking for, with the health department and my office and here, we're looking for people to be what we call neighborhood nurses. This is an old concept. You maybe have heard of the church nurse. This is a person who doesn't have to fit a program like when we have home health nursing that you have to have X amount of problems. This is a nurse who can go in because you call here to the Office of Aging and you say, I need someone to come out and evaluate my mother or my friend or whatever. These people are gonna be out in the community. So I want you to just think about all those resources, and I'm opening this panel. We have lunch coming up here, right, ladies? One momentito. Yes, we will take a moment. We have time. Did anybody need, I can shut up. I talk a lot, but I can shut up. So, anybody have thoughts, questions, things for the panel? This panel, you guys did great, absolutely wonderfully. What exactly we're gonna do?
A couple of thoughts that I had post-COVID was the technology issue that you already mentioned for the elderly. You know, we have all these great things available, and people started learning how to use outside curbside pickup, pharmacy delivery, grocery delivery. But for the elderly and the people that I see in home health, they don't really have the abilities or the know-how or the technology available to them to access those things. So that was one thought I had. I'm looking for some mental health resources. I don't have any access to those that I'm aware of. And then the other thing that I see post-COVID is a lot more hoarding in homes, and some resources to kind of help those folks that are living in conditions that really aren't safe and just unhealthy.
Thank you. Other folks? Hands?
How about comment? I
Why
don't need the
don't you
mic.
come up here and just.
I don't need the mic. Can you hear me?
Yes. Yeah.
I'm loud. I like to talk to.
Just easier for you.
All right.
Remember, some of us are hearing impaired.
Okay, so one thing that I've noticed after COVID, and I think that all the people that are here that are in healthcare, nurses, physicians, PAs, people that take care of others at home, one thing that I've noticed is that after all that what COVID brought in to all the communities, including the political things that came with COVID, I've noticed that there is way more reluctancy to have vaccines in general. Not only the COVID vaccines, which we know scientifically has been proven that they do work. Maybe there is somebody here that don't think that way, but this is the official medical statement. So there is also reluctancy now to get tetanus shots and pneumonia shots, and so more than before, flu vaccines. So I think that we all need to be advocates of what science brings to the table and what medicine brings to our communities, which one of the things that we know, the population in the world has skyrocketed the last 100 years because we have vaccines. It's not because, we all got all cleaner and have better water. Yes, that helped. But vaccines is along with antibiotics, are the two things that we were able to do as humans in the last 100 years to be able to be how many we are now. So if we are gonna go back to not vaccinating our kids, there's more and more people now choosing not to vaccinate their kids, and older adults not getting the pneumonia vaccines and the flu vaccine and the tetanus vaccine, guess what? We have started to see already measles coming back, and more people dying from other diseases or having diseases that were not even spoken about in the United States or the civilized world or the first world, as we call it. So I think that we all need to be advocates of our patients and our family members to talk about from the place of wisdom, not coming from Facebook or Twitter, to talk about how the vaccines are good for our communities and for our fellow humans. I just wanted to say that.
That's very important.
It's great.
Now, thank you on behalf of the health department.
Teresa, put your hat to that for sure. Comments, questions? Come
I
right
just
here.
wanted to say
You're great. Can you?
I just want to say as an informal caregiver that the talk about giving us more support, more information, because it's all new for me. And, we're trying to do what's best for my mother and what's, most helpful. What can I expect? What's some of my resources? I mean, I don't live in this county, but I think that's very important, especially as more and more people are being diagnosed with,
That's a very important thing to share. What we hope is that by calling into the Office of Aging, by calling into what will be the Safe Path office, that someone will come out and go over all this myriad of stuff that Christy went through today, which for you, many of you, it was a review, but for some of you, it was new. And there are things that you need to know, like where do I get resources? What is this thing with the legal issue? What do I need to do about guardianship? I mean, blah, 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 blah. There's a lot. I personally lived through 12 years of my mother's having Alzheimer's, and when we started, it was like a desert. There was nothing, So at this point, it seems like there's a lot going on, but I realize if you're new in the scene, it's the same desert, for sure. Other thoughts? Everybody's just hungry. Well, I want to thank my panel. I think you guys did wonderfully. I would definitely like to put COVID in the rearview mirror, but I want you to know that I'm afraid, as we learned, that in this day and age, we probably learned how to take care of this particular virus, but there are other viruses, so we just need to, don't throw those masks away, guys. Just don't, keep them in your top drawer, keep a set of clean ones, it'll be great, so we'll go from there. Jennifer, you have been very quiet and silent today, I know you've been busy.
That's unusual, isn't it?
I'm just, I know you're.
Yes.
Jennifer really deserves all the credit for making this
No,
happen.
I do not. I have such a fabulous team. They're out of this world. You will die when you see this lunch delivered to you, how beautiful it is. You will be quite impressed.
Okay, Julie and I have just a few pieces of business to tell you about, hopefully. The first one is, this is a monstrous favor I have to ask of you, and I'll explain. before you leave here today, and probably best during your lunchtime, there's a little paper called a PRF, Participant Registration Form. It just asks for your name, your address, your phone number. If you have an email, you need to sign it and print it. And if you have questions, raise your hand. I will come and help you. If you're Hispanic or not, or if, just if you live alone or poverty line, those kinds of things. But what filling this out does for us at this center, number one, we're required by the state to have this because for example, Office on Aging, we get money for the center for the Office on Aging. And how do we do that? It seems ridiculous because my love, I guess you could say, is just one-on-one interaction with a real person. But sadly, we have to have this paper to prove that we've given you this information, and then it's put into the computer in a brand new data system that has driven us insane. And then it translates to a unit, and that unit collects money for this center and supports this great place for our community and its senior participants and community friends. So I need for you to do that. And also, I'm gonna call out a couple of names here because okay, let's just pick one. Julie. We have a few door prizes.
Whitney Beatty.
Whitney, go up to the table and get a gift. Their age? Yeah, their birthday. Yeah, their birthday. The birthday's on here. You'll have to do the birth. Yeah. And the next one is run, Julie, run. Oh, Teresa, come on up. Let's showcase our health department director. I know I don't either, Teresa. I've never won anything. Jackie, oh my goodness, she put the watermelon on the lasagna to make it look gorgeous. Go get her. Go in there and get her. And the last bit of business, we gave you a certificate. We're giving you a certificate. We will give you the certificates at the end. I'm just reminding you, you will get a certificate of having completed this, if you want to call it, training. So I truly appreciate your doing that too. Hold on. And we're going to deliver your meal. And it's gorgeous. Hold on.
Does anybody want vegetarian?
You'll deliver these to the table.